West Australia's top doctor has claimed the Premier's hard border policy is not based on health advice. The state's chief health officer also told a parliamentary inquiry moving to phase 5 restrictions as planned for the end of the month could make WA more vulnerable to a COVID outbreak.
WA's hard border has been a bone of contention for weeks as support for the closure starts to wane. Now, in an astonishing submission to a parliamentary inquiry, the state's chief health officer admits Mark McGowan's island within an island is no longer based on health advice.
The Premier has been caught out by his chief health officer. I think he's motivated by fear, ensuring that the West Australians feel scared, and that's what the border arrangements have been based on.
They have had community spread of the virus in New South Wales and Victoria, and many people have died, Mr Speaker. If the Liberal Party has its way, that will happen here.
The Premier has for months claimed the hard border remains in place due to health advice and that travel bubbles are unconstitutional. But Dr Andy Robertson's latest guidance suggests borders could be reopened and quarantine abolished to states who have had no community transmission for 28 days. That would apply to every state and territory in the nation except for New South Wales and Victoria.
If things continue to improve, we could consider either opening the borders to states with no community spread, or we could look at broadening the exemptions to other states.
The Chief Health Officer is satisfied with other states' border arrangements, but admits border jumping is still a concern.
People from New South Wales, for example, can go into South Australia and then could come into WA, so that is still a consideration. They're at different stages and different restrictions, so if we're looking at borders, we also have to consider what that means for opening up our societies.
WA's top doctor has also claimed the state is already susceptible to an outbreak, but moving to phase 5, which is pencilled in for October 25, would make WA even more susceptible and make reopening the border even more difficult.
Basically, moving to phase 5 would actually allow us to return to normal, which would remove basically all social distancing.
Emily Evans, Sky News, Perth.